with the first cystose. All right. I told you the cystose is happening in human. They are adult or larval stage. Most of them have 4 suckers, but a few of them, instead of suckers, have botria, okay, for the as attachment organs. Okay, all the cystodes at the adult stage are living in the intestine, okay? This is intestine, and they have attachment organs which help to remain in the human body. This is the general, actually, characterization of the cystodes. I told you they have scolex. The head of the cystode is called scolex. Scolex, neck, immature proglottid, mature, and this one is gravid. Gravid is full of eggs, okay? So this is an example of the egg of the cystodes. Inside the eggs, there's an embryo which is called oncosphere. When the egg is eaten by the intermediate host, in different part of the body, the larval stage is developed. The larva of the cystode is called metacystode. When the larva is eaten by the definitive host, they are living in the intestine. So remember, all the cystodes, either human cystodes or animal cystodes at the adult stage, are living in the intestine, but the larvae is happening in different part of the body. Okay, before to go through the details of the cystode, I want to show you a clip. Okay, how can I change the picture? Tapeworms we are going to talk about is called Echinococcus granulosus. Okay, Echinococcus granulosus is a small tapeworm, just a few millimeters in length, living in the intestine of the dog and other canids. When this tapeworm is just a few millimeters, thousands of the parasites can live in the intestine of definitive host. We have cystodes from a few millimeters to more than several meters, okay? When the legs is too large, like Tinea saginata, they are usually just one adult living in the human intestine. Okay, this is the egg of the cystode. Inside the eggs, there's an embryo which is called oncosphere, and this is the layer which protects the embryo. When the egg containing of the embryo is eaten by the intermediate host, they develop to the larval stage in the intermediate host. According to the structure of the larvae, we have different names. Metacystode is a general term for the larval stage of the cystos. Okay, all the helminths have adult stage and larval stage. Here are the most important helminthic diseases which caused by the larval stage of tapeworms. These are the name of the tapeworms. Echinococcus granulosus, one of the most important tapeworms. Actually, the adults are in the dark. The larval stage are in different herbivores, but human can also be infected to the larval stage of Echinococcus granulosus. In this case, the name of the disease is Hydatidosis or cystic echinococosis. Do you know what it means? Osis? Osis means the disease. Echinococosis is a disease caused by Echinococcus species. There's another tapeworm which is called Echinococcus multilucularis, which lives in the intestine of fox and other canids. The larval stage is called alveolar echinococosis. Okay? The next one, Tinea solium, is a tapeworm of human. Intermediate hosts are usually pig, but human is also susceptible to the larval stage. The disease is called cysticercosis. There are some other Tinea species which may lead to human disease. They are very rare, like Cenoriasis. These ones are all cyclophilidian. The tapeworms which have 4 suckers, they are called cyclophilidian. But in the pseudophilidian, that they have botria, we have spirometer species. When I say SPP, it means more than one species. SP means one species, but SPP more than one. There are several species of spirometra which leads to asparagnosis. So this one, cystic echinococosis, alveolar echinococosis, cysticercosis, cenoriasis, asparagnosis are helminthic disease by the larval stage of the parasites. But we have some parasites which their adult stage happening in human. All of them lives in intestine. Okay? In this group, we have Tinea saginata, Tinea solium, Tinea striatica, Hymenopus nana or H. nana, Hymenopus diminuta, and Diphyllobothrium latum. The first one, Echinococcus granulosus, one of the most important helminthic disease of human. They have widespread distribution in all continents, okay? So it has widespread distribution. It is very important because it may lead even to the death of the human. So this is a zoonotic parasite which is important in all the continents. We have this problem in your country, Iraq, in Iran, our neighboring countries. All right, this is the cyst of parasites which develops in internal tissues of human. Actually, in Echinococcus genus, we have the species of Echinococcus granulosus, which have widespread distribution, Echinococcus multilucularis, just in the northern hemisphere, Echinococcus vogeli and Echinococcus oligarchus has both at the definitive house, intermediate house in the wildlife, and they are just in the Central and South America. So we are not going to the details of this species, but we are going to talk about cystic echinococcus and alveolar echinococcus. Echinococcus granulosus, just a few millimeter. This is the scolex, hoops, suckers, the segments, you see, just a few segments, immature, mature, and proglotid. And this is the genital pole, which is lateral. They have different genotypes. We just about the species. As you see, they have widespread distribution in all of the worlds, but the prevalence in some parts is higher. You see, you have this problem in your countries, in neighboring countries. And as I told you, definitive house are dog. So in the nature, the parasites happening between the dog and herbivores. But what is the role of human? What is the role of human in this life cycle? Actually, accidental house. It means the presence of human in the life cycle is not necessary. The life cycle is happening between definitive house, the dog, and intermediate house, different herbivores like sheep, goat, cattle, camel, even wild herbivores. But human get accidentally infected. As you see, we have even wide definitive host. So the people are hurting or at the risk of infection. The life cycle is between definitive host and intermediate host. Here you can see how intermediate hosts are very wide. The wild herbivores and domestic herbivores. What are the risk factors? The people who has close contact with a dog, especially stray dogs or farming dogs, they are at the risk of infection. Or the children used to eat the dirt are at the infection. Some vegetables, any vegetables infected with the egg of the parasites, they are at the risk of infection. So the important part, we have egg with an embryo. The embryo has 6 hooklets. The hooklets actually help the embryo to penetrate the intestinal wall. So the adult parasite is in the intestine of the dog. The eggs are released in the environment. Inside the eggs, there's an embryo. When the eggs are eaten by the people, the embryo penetrates the intestinal wall and through the blood, they circulate and any other tissues are at the risk of infectivity, especially liver. 70% of the cysts in human are happening in the liver, 20% in the lung, and 10 other percent to different tissues like in the brain, in the heart, in the kidney, any part we have blood circulation. So you see the adult stage or the pathology is very severe compared to those living in the intestine. The helminths living in the intestine, the diagnosis is actually feasible. For example, for me as parasitologist, when I see the eggs or the proglotid, I can say exactly the parasites infecting the human. But when they are in the internal tissues, we cannot see the parasites. We need to use serological tests and imaging tests for the diagnosis. And each one have its own advantages and disadvantages. But the pathological or symptoms for those parasites living in internal tissues, for example, in the liver, in the lung, in the kidney, actually are more severe. The last things, the treatment of those infecting the internal is much difficult and sometimes we need to do surgery. But for those living in the intestine, even with the single dose of antiparasitic drugs, we can have proper actually treatment. So here I want to show you the risk factors. People at the close contact, especially children, with the animals, farmers are at the risk of infection. Ladies, they are actually working with the vegetables, they are at the risk of infection. Such practices, you see, in endemic areas, dogs are often ready to access to the viscera of the slaughtered animals, or like this one, okay? I told you about the morphology, but I'm showing to you in the practical class. I just here to want to show you when the size of the parasite is small, too many of the adults can live in the intestine. This is the morphology of the egg. This is the Hydatidosis. Do you know, or can you guess why Hydatid? What is the actual meaning of Hydatid? is related to the fluid. The cyst is full of fluid. So hydatid means a cyst which has full of fluid. Inside the cyst, there's the parasites. This is a cyst which has been developed in the liver. The main cyst is called mother cyst. Inside the mother cyst, there's many small cysts which are called daughter cysts. Actually, the daughter cysts have the same structure of the mother cyst, except they are smaller. This is a schematic view to show you different layers of hydatid cyst. This is the normal tissues of the host. This is the cellular reaction of the host. This green part is related to the parasites, which is called laminated layer. It is thick and without any nucleus. But this pink part is very important. It is called germinal layer, okay? Inside the cyst, which is full of fluid, this capsule are called broad capsule. In the broad capsule, we have the parasites, which is called protoscolex. In one cyst, thousand and thousand protoscolex is happening only by one single embryo. So can you imagine? By one embryo, a cyst is developed, for example, in the liver, full of protoscolexes. When such cyst is eaten by the animal, for example, dog, one cyst can develop with many thousand protoscolexes. Here is actual cyst. This section is stained with hematoxylin and eosin. This is the liver. This is the fibrotic tissues of the house. This is the laminated layer, germinal layer, protoscolexes, and broad capsule. As you notice, the germinal layer has is darker compared to the laminated layer. Okay, this is broad capsule, protoscolexes, germinal layer, and laminated layer. I told you too many herbivores can act as intermediate host of Echinococcus. If you refer to a slaughterhouse, you find such infected liver, okay? Inside the cyst is fluid. If we sediment, at the sediment, we have too many protoscolexes, broad capsule or daughter capsule. Okay, this is the life cycle. As you told you, human is accidental host. It's not necessary to be in the life cycle. The life cycle is happening between the dog and other, between the dog and intermediate host. So adults in the intestine, eggs in the environment, eggs are eaten by the sheep and other intermediate hosts. They develop to the larval stage, which is called hydatidosis in different tissues. Human infectivity is similar to intermediate hosts. It means they have the cyst in different tissues of the body. This slide wants to show you the actually when human eats or drinks contaminated water vegetables, the eggs come in the intestine and the embryo move to different parts of the body, especially in the liver. Let's talk about the pathogenesis. So we have the parasites developing in different parts of the body, especially in the liver. The pathogenicity is related to the pressure of the cyst, allergy to the fluid, and actually when part of the germinal layer or protoscolex move to other parts of the body, they can develop to new cysts. This is very dangerous. So If during the surgery or even by the trauma, the cyst rupture, they may lead to secondary cyst, or the fluid may lead to anaphylactic shock. All right? So they are very toxic for human. The symptoms: if somebody is infected with the larval stage of Echinococcus granulosus or Hydatidosis, the symptoms are partly dependent on the site of the infectivity, if either in the liver, in the eye, in the brain. So they have sometimes general symptoms and some specific symptoms. As I told you, most of them are in the liver, as you see, okay? In the liver, the patients have abdominal pain, nausea, vomiting, jaundice, okay? If they rupture, they may affect other part of the body. In the peritoneal cavity, they may be so big, we have the size of the cyst, even at this diameter, okay? But most of the patients, they are referring to the laboratory, the cysts are about 5 to 10 centimeters in diameter. In the lung, I told you 20% are happening in the lung, all right? So the patients have pulmonary symptoms like chest pain, shortness of breath, and sputum. And the sputum is salty. Can you tell me why? Why the sputum is salty? Because of the fluid. The fluid inside the cyst gives the sense of salty to the patients. This is the brain cyst. As you see how big it is, the brain cyst. During the infectivity of the brain, the symptoms are earlier, okay? The patients have headache, vomiting, mood alteration, and skull deformity. This is the actually bone, infectivity of bone. This is the renal system. The parasite, the protoscolixes or hooks may be found in the urine, okay? This is a rare case of the infectivity of the eye. Usually one eye is involved and the patients have proptosis, okay? This is, let's go through the diagnosis. The history is important. What is the occupation of the patient? If they are at the close contact with the dog, if they used to eat the vegetables which are not properly washed, the history is important. During the recent decades, use of imaging techniques are useful both for the diagnosis and for the treatment during especially surgery. Okay, so serological tests are very important. When the parasites are living in the intestine, parasitological tests are important. But here, parasitological tests are not helpful because we cannot find the parasite. But serological tests, especially ELISA, is used for the diagnosis. Because of the importance of this disease, because of the wide distributions, there are many actually laboratory kits can be used in the laboratory for the diagnosis of infectivity. Do you know what is the base of serological test? What we are looking during the test, for example, ELISA?
No, the test.
Yes, what is the base? Exactly. Exactly. When we are doing the serological test, we are either going to find the antibody against the parasite or antigen detection. But most of the available kits are based on the antibody detection. So we use serological tests, especially for the disease like hydatidosis, that we cannot use parasitological tests. In addition of the serological test, imaging techniques like MRI, CT scan, sonography are very important. These are the ordinary imaging techniques. Okay, for the treatment. For the treatment, we have difficulty. Actually, we don't have any anti-helminthic drug which affects on the cyst, for example, in the brain, in the liver, and kill the parasites, actually without side effects for the patient. Okay? Presently, World Health Organization proposed 4 strategies for the treatment. The first one is watch and wait. It means if the cyst is small, if the cyst is in part of the body which there isn't the risk of the rupture, okay, we should follow the patient. It means every several months we do a new imaging and to consider if the cyst is growing, if the cyst is actually active, so we need to move to other strategies. But if the cyst is going to be calcified, leave it. Okay? Because the surgery of the hydatidosis is very crucial and very actually dangerous. All right? So the next strategy is use of chemotherapy. It means anti-helminthic drugs. The next one is a technique which has been introduced at the decade of 1980, and in many cases it can be replaced for the surgery. The last one is surgery. Okay, based on the result of the sonography, World Health Organization divide and name each one to different, for example, C1, C2, and then say you need to consider one of these strategies for the treatment, either watch and wait, either surgery, chemotherapy, or hair. For the chemotherapy, one of the most important drugs, especially for the platyhelminths, is praziquantel. You will hear this name many times during the course of helmintology. Praziquantel. Praziquantel is an anti-helminthic drug for all the tapeworms and flukes except one, which is Fasciola hepatica, that I'm going to talk about that in the third session. So praziquantel, remember, is one of the most anti-helminthic drugs. The other ones are benzimidazoles. Benzimidazoles including albendazole, mebendazole. So the chemotherapy is for the hydatidosis or this group. Sometimes the combination of praziquantel and mebendazole or albendazole may be used, which is more effective. Okay, let's talk about hair. P means puncture, okay? A means aspiration, I means injection, and R means re-aspiration. When the cyst in the liver or any part that can be accessed through the skin, okay, and the size of the cyst is about 5 to 10 centimeters, not too big, not those ones which are in the brain, okay. For example, mostly in the liver cyst, actually for puncturing the cyst, and the cyst is full of the fluid. The fluid will be aspirated, and a fluid which has anti-protoescolic effect is inserted. After several actually minutes, it will be re-aspirated. So it is called pair method. Pair methods can be replaced by the surgery. It can many times actually remove the side effects like anaphylactic shock, secondary cysts. But sometimes the cysts are too large, or they are in the brain, in the actually part of the body which cannot be available through the pair. In this case, We don't have any other choice except surgery. It needs teamwork, and the surgeons needs to be very skillful. The contest has been removed from the surgery of a patient. Okay, somebody may have dog and they are concerned if the dog is infected in the dog because they are living in the intestine. The diagnosis is very easy, finding the egg or the prognatid in the stool. Although the ELISA and PCR is used, it is mostly for the molecular analysis. What is the actually principles of control? For the control and prevention of every disease, you need to consider the life cycle. We have dog, we have herbivores, we have human activities like close contact with the dog, you actually eating unwashed vegetables, okay? So in this case, actually health education is very important. Avoid close contact with the dog, especially for the children. They should not lick, let the lick actually their face. A vaccine has been developed for the actually intermediate house, and it is under the actually to find the efficacy in the new future can be used for the intermediate house. Sanitary disposal of the offal is very important. When a liver containing proteolysis is fed to the animals, actually they are keeping the life cycle. So it is very important to avoid such practices. And for the people, as for the occupation, they are in the close contact, they need to wash the fruits, wash their hands, and other actually prevention measures. Do you have any question? Okay, let's. Actually, the chemotherapy we use for the hydatidosis and larval stage has parasitostatic effect. They cannot kill the parasite. Okay, and the surgery, those ones which are too large and they cannot be treated. Chemotherapy is for the small cyst, and those can be inactivated. Each one has its own actually mode of action. For the praziquantel, they are affecting on the beta tubulin of the parasites for the mebendazole. But praziquantel affect on the tegument of the parasites and disturb the absorption of the calcium. I don't know what I answered. Oh, you mean what about the water? When they are calcified, the water is be actually absorbed. Okay, when they are active, they are full of fluid. But when they are calcified, they are going to be solid. All right. For the do you mean why they are bleeding? Oh, you mean there is risk of the new cyst before the surgery, and after the surgery, chemotherapy is necessary. It means surgery is not alone. Okay? Before the surgery, the patient need to have chemotherapy to actually prevent the risk of secondary cyst. Even after the surgery, for several months, they need to do chemotherapy. It means surgery is not alone.
operation, there is bleeding in this operation. So bleeding in the brain, does that mean death?
Excuse me. میشه ببینید سوالشون چیه؟ شاید من متوجه نمیشم.
أثناء العملية الإزالة للدماغ راح يصير bleeding.
عمل وقتی زیاد میشه بیمار نمیمیرن بخاطر خونریزی.
بعضی موارد متاسفانه مرگ هست، یعنی یکی از در واقع خطرهایی که برای جراحی کیست هیداتیک وجود داره مرگه، به خصوص در گذشته که تنها متد سرجری بوده. you know previous decades the only method for the treatment was surgery and we had some patients dead during the surgery. There is the risk of the death, but we need to have teamwork, okay? But some of cases, there's no other option. They have to do the surgery. But there is the risk of the death for some patients, unfortunately, yes. Okay, the next paper is called Echinococcus multilocularis. It is just a few millimeters, even less than Echinococcus granulosus. If you look to the distribution, it's not found in the southern hemisphere. It is just in the northern hemisphere, and it is important even in the actually developed countries like European countries. Due contact with the definitive house, which is fox. So definitive house is fox and also other canis like dog, okay? One of the most important things about the life cycle of these parasites, intermediate hosts are small mammals, especially rodents, okay? So because of the intermediate hosts, which are rodents, so human cases are very rare. Actually, these parasites have wide life cycle. The people who are going actually in the forest, they are at the risk of infection. So normal intermediate hosts are rodents. Human may also be infected. In human infectivity, 90% of cases are happening in the liver. 90% in the liver and 10 other percent in other part of the body, for example, spleen in the brain. The name of the parasites, parasitic disease, which is called alveolar echinococosis, is because of this nature of the cyst, okay? They are not like hydatidosis, oval, full of fluid, okay? They have several cavities, okay? Multiple cavities. So it is called alveolar cyst. If the cyst, the liver is infected, it means most of the parasites are extragenous budding. They have extragenous budding, and like cancer, they do metastasis. So this disease may be mistaken with actually malignant diseases, especially liver malignant diseases, and it is called white cancer. It is not cancer, but it is known as white cancer because of the actually the appearance of the cyst, which is like actually cancer of the liver. Here I want to show you a liver highly may be damaged. That's the reason it is called actually white cancer. Most of the liver parenchyma is involved. It is involved actually, and this parasite is even more dangerous than hydatidosis. And if the patient is infected, it leads even to the death, or they may have long-lasting antiparasitic parasitic disease like benzimidazole for 10 years, for whole of the life, and some cases actually need to have resection of the liver or actually a new liver transplantation. So these parasites, the patient may be candidate for liver transplantation. For the prevention, for the diagnosis is very similar to hydatidosis. Actually, we have the parasites in the internal part of the body. The serological test and imaging techniques are very important. So diagnosis is very similar. For the treatment is actually difficult, but we need to do surgery or liver transplantation or resection. The antiparasitic drugs are albendazole, all right, even for the a decades or whole of the life. For the prevention, it is difficult because the life cycle is happening in the wildlife, but some actually things, for example, prevent the forest berries and handling the food of the parasites is important. Some countries in the European countries, they use praziquantel baits to control the parasite in the fox. It was useful, but after leaving this practice, the life cycle is again established. So it needs long time actually use of this method. Okay, I just want to show you the life cycle. Definitive house, intermediate house, human can be infected through close contact with the dogs infected with the egg. So you are going to have a rest. After the rest, you have a small quiz about the material I told you, and you have, don't worry about the actual mark. It is just to remind you the most important point. Your collaboration is enough to be actually a merit for the final exam, okay? After the exam, for every question, I'm going to tell you the answer and the reason which answer is correct, which one is not correct, all right? So don't worry about the result, just participate in the quiz. Before that, you are going to have a rest, all right? 15 is enough? No? 20, all right, 20.